Take a look at how COVID could affect your heart, even if you don't have a severe case of it. Once again, Denise Jefferson.
They have persistent symptoms or new symptoms that are unexpected.
A new study found that COVID can lead to heart problems even after you've recovered from the virus.
The patients who had recovered from COVID-19 had all sorts of cardiac issues.
The risk of 20 different heart and blood vessel issues increased in COVID patients up to 1 year later. Some cardiologists say they've seen it with patients at AU.
These include things like heart attack, heart failure, heart rhythm problems.
Even patients without severe COVID symptoms could end up with an increased risk of heart problems.
I've seen both healthy patients after COVID-19 infection who had long COVID syndrome, as well as patients who had underlying disease or risk factors for disease.
Doctors say COVID-19 damages the lining and blood vessels, which causes the virus to impact other parts of the body.
And that's one of the reasons it is able to affect so many different organs in the body. That's why patients who have long COVID have symptoms that are related to their brain, heart, gut, kidneys, and even legs.
Doctors say that's why if you haven't contracted the virus, prevention is always key.
Getting vaccinated and social distancing and taking these precautions to prevent getting COVID-19 infection is the best thing that anyone can do.
In Augusta, Denise Jefferson, WJBF, News Channel 6.